Hello, in this video we are looking at intake and output of fluids. So when we're talking about intake of fluids, we're talking about all the fluids that enter your patient or client. Typically, you will be working with a chart where you will record both the time and the amount and type of fluid that is either entering or exiting your patient. So for intake, we want to include all fluids that your patient ingests. So this would be things like orange juice, coffee, tea, broth. I point out coffee and tea because these items contain caffeine. They are still included as intake. And I also point out broth, which is the clear liquid and is different than soup. So we want to include broth as a warm liquid, but something that would be counted as intake. We also want to include all liquid medications. So we'll often see those as teaspoons, tablespoons, potentially an ounce, sometimes milliliters as well. We want to include fluid used to swallow pills. So they may end up using an ounce of fluid to swallow 2 capsules or something of that nature, and we want to include the ounce of fluid. We must include all IV fluids. And so this would be their primary IV, and then if they have an antibiotic mixed with a secondary IV, we would include the secondary IV fluid as well. And we want to include tube feedings. So these would be liquefied nutritional supplements that are used for some patients and would count as part of their intake. We want to include items that are liquid at room or body temperature. So the first item that I'll call your attention to is ice chips. And because ice chips have a reduced volume when they melt, you would record ice chips as half of their volume. So we see in this image a glass of ice chips, and that would probably be counted as 4 ounces or 120 milliliters instead of the full glass. We want to include frozen treats and gelatin. So frozen treats might be things like ice cream, a popsicle, Italian ice, etc. And then gelatin, the brand name for that is Jell-O. So you might see a gelatin or you might see Jell-O. For those items, they are recorded by the milliliters on the package, and you will see that with your hospital food. And then, of course, there are items that we don't want to include for intake. So obviously, no solid items, but that can be trickier than you think. So the first thing that I call your attention to is the way that we use the word ounce for both liquids and solids in our American system. So here we see 2 ounces of crackers, and here we see 8 ounces of water. So you're going to be needing to read carefully so that you include ounces when it's used for liquid and not when it's used for solid foods. Next, on items that we do not include are ones that are very confusing because they're close to liquid form. So we talked about with soups that we include broth, but we are not going to include cream soups, and we're not going to include soups that contain chunks of food. So if they are served just plain broth, yes, include that, but not soup in general, not cream soups, not soups with chunks of food. Next, we noted on the slide that we include fruit juice. So we had orange juice, but we do not include fruit beyond juice. So no applesauce, no fruit cocktail, and sort of in that same genre, no yogurt. So those are all out. And then we did include gelatin, which has the brand name Jell-O, but we do not include jelly. So jelly and butter, even if the butter melts on their toast, butter and jelly are not included as liquids. When we get to the scenario of output, it's a little bit easier. So if their fluids are being monitored, everything that leaves their body will be somehow caught and measured in milliliters. So the things that leave their body in fluid form would be things like urine, wound drainage, watery stool, and vomit. Now, one thing that you do have to be aware of is that solid bowel movements are not going to be counted. And when we're reading a paragraph for a word problem, those might be mentioned in grams. So grams is a measurement of weight, not a measurement for liquid, and so we cannot include it as liquid. So when we are looking at output, everything that we see on this list is all going to be measured in milliliters. And we know that the metric base of liter is for liquid, and so milliliters is that common unit that we'll use for all of these. And as you see in some of the images here, we will be using specific containers to catch those liquids and measure them before we dispose of them. And we'll also record all that information on the chart. So one additional calculation is hourly urine output. And so for hourly urine output, we're looking for 30 to 50 milliliters per hour, and we're looking at renal function when we're asked to do that calculation. When we calculate hourly urine output, we're going to use this understanding of that, which is the total urine divided by the hours of the shift. So if I take a look at this particular problem, the urine is under this column. The total urine for the 8 hours is already calculated right here. And so what we will do is we'll take the 925 milliliters that has been recorded and divide it by the 8-hour shift. And then we'll actually go to our calculator and do that math. So grabbing my calculator here, I take 925 divided by 8, and I have 115.625 milliliters per hour. So well above that threshold that was mentioned here, but you do not need to memorize the threshold. What you do need to know is the calculation. And the question that students often run into is, should they be using the total shift, or should they just look at the time elapsed written down under this time column? And the answer is you should be using that total shift. So when we do the hourly urine output, it is the milliliters, total milliliters of urine divided by the total hours of the shift. So that's all for our video. If you need to go back and refresh anything, you're welcome to do that. And do make sure to take some good notes as to what does count for intake and what does not.